Dr. Brad Hall here from Fenix Physical Therapy. Today we're going to be talking about low back pain. One of the big things we've noticed as a first responder specialty practice, as we've gathered data over the course of hundreds of injuries and thousands of physical therapy visits, we analyzed our data and 53% of all of our first responder injuries have some strong correlation to low back. And so today what we're going to do is teach you a generalized philosophy of how is it that we can treat our low back. You'll notice that there's a major emphasis on flexibility and mobility of the hips. So today as we talk about those, pay attention to the ways in which we can assess and then retest the effectiveness of different interventions. And so what I'd like to show you first is a way that you can first assess the different mobilities or different movements of your spine. The very first movement of a spine is that we should be able to flex forward and we should be able to extend backward. A simple way to assess this movement is just like that. Athletic position. People may be over concerned with knees being locked or not. That's not overly important. The first thing to look at is bending down toward the toes. How do I feel? Second movement is looking back. A lot of times I'll cue people, put your hands on the back of your hips and press forward and look up. The amount of motion and how you feel are the two things that you want to pay attention to. The second movement of the spine is its ability to side bend. So I'll tell people stand nice and tall and you're going to side bend down like you're trying to touch the side of your knee. The next movement will go to the opposite. The third movement of the spine is most easily assessed in sitting, but it's rotation. And so what you'll do in a sitting position, the knees are going to squeeze together, the hands are going to go across the chest, and you're going to rotate to the right and to the left and test how much rotation there is of the spine. So first motion is bending forward and extending backward. The second movement is side bending, and the third is rotation. Before doing any of these interventions that we're going to teach you today, I invite you to assess your movement, pay attention to how much you move and how you feel. After you introduce these stretches that we'll show you today, retest and notice what does your movement feel like and how does your pain feel.